right around the corner. Then you've got the University of Illinois Chicago, UIC, and they're competing with Rush. And it's so funny. They're competing because they have the liver transplant program, so they're always fighting. Rush offers valet parking. That's so important, don't you know? Right? That's a big deal. You have to have valet parking. UIC doesn't have that. These hospitals also compete with the other hospitals in town. Northwestern University built a state-of-the-art hospital. So now Rush Press is building a brand new state-of-the-art hospital. We don't need that hospital. Our tax money is paying for part of that. And part of that new hospital, which we don't need, is going to specialize in orthopedics and sports medicine. Now, I find that interesting. I mean, there aren't that many professional athletes in Illinois, and we know Americans don't exercise, so they're not going to get injuries from doing sports, right? So it's like, why the focus on that? Because it's profitable, right? These are people who have insurance, but we need primary care. That's what we need. We don't need that, but that's what we're going to get. So that's right down the street from us. It's so awful every day when I go by it to have to see that and say, we don't need that. They need to take our patients. We are so overloaded at county. They need to take their fair share of the uninsured, but that won't happen because you don't make money on those people. Okay, so we have this destructive cycle because of competition where the investors who own these things, they acquire hospitals, they integrate, they outsource, they combine, recombine, sell off, they close the ones that aren't profitable anymore. They're closing lots of hospitals in small towns and community hospitals because they're not profitable anymore, and they're building hospitals in wealthier neighborhoods. That's happening in the wealthy suburbs of Chicago. And it's really this competition that fuels this medical arms race that really ultimately most people don't benefit from. You have a duplication of services, really high administrative costs because you need people, right, to keep this whole thing going. And then the massive confusion, right? I mean, I can't even understand. I mean, some of the patients who come to county do have private insurance. We can't understand what we have to do to get them. We have to call people. We have to submit pre-authorization. Somebody has to sign off on this. The system is so weighted down with a massive bureaucracy, and there's a reason for that, and it's competition is the pursuit of profit. Now, that isn't to say the competition doesn't play out so much in rural parts of the United States because there's no competition in terms of hospitals. There's one hospital. So this idea that you could, I don't think they've worked that out. How would you, in a small town, have more competition if there's only like one hospital? There's not that many people. So it doesn't make sense on that level. So actually what we really need is cooperation among the system. That's better for patients, it's better for patient care, and it's better for people who actually want to help patients to cooperate and not be in competition with one another. So really, we have a system that is full of division and disparity and discrimination. So now I just want to turn to why is healthcare of such critical importance? You know, why is this an issue that has really ignited a serious grassroots movement for change in this country? And really, I think the reason is it's probably obvious. Access to healthcare shapes our lives in every single way when you think about it. Now, the first thing to say, and I'll say it a few more times, 45,000 people die every year. That is a crime against humanity. In the richest country on the planet, that 45,000 people die every year. So if you're uninsured, your health is at risk, right? You don't get that prevention. You don't go to the doctor and they see this thing and they take it off. You don't get your blood tested to see if you have diabetes, so you immediately can make some changes. Which actually, if you just want to look at it fiscally, which I never like to look at it just that way, but of course our government does, if you do prevention, you save money on the other end. They don't look at it that way. They can't look at it that way because it's about profit. You know, the remote area medical team, a group of doctors and nurses and other healthcare providers, they go around the country, and they've done it in the United States now, and you just see 9,000, 10,000 people line up for healthcare. That's the state of healthcare in this country. So, you know, you get diagnosed too late and you have all kinds of life-changing health problems, like you have a stroke and you can't work anymore. You end up on dialysis. Or, you know, we have this regularly. People come into our clinic and they get a diagnosis of cancer and it's probably going to be too late. I mean, the stakes are that high, right? When someone comes in, they've never had health care, and now they have cancer, they have some other disease, and they're probably not going to make it, or the last couple of years of their lives are going to be miserable. That's why this issue hits home so hard for people. Children who are uninsured, there was a new study out, 60% increase risk of dying in the hospital. That was a study out of Johns Hopkins. We have 7 million children in this country who are currently uninsured. If you look at the state of mental health care in this country, absolutely atrocious. We don't have a mental health care system in this country. If you have a mental illness and you don't have insurance, and even if you do, you're going to have a hell of a time. So who are the biggest providers of mental health care in this country? The prison system. In Chicago, it's the county jail. In Los Angeles, it's the county jail. And in New York, it's Rikers Island. That's where they're the biggest mental institutions where people first get medicine, they first see a psychiatrist or a therapist in this country. That is also a crime against humanity. People who are homeless disproportionately suffering from mental illness. We don't have a system that can respond to that. Related is we pay the most money for prescription medication than any other country in the world. People skip medicine all the time. We hear it every single day in my clinic. Well, you know, I can't take it every day because I won't get to the end of the month. I can only buy so much medicine. I have to make it last till the end of the month until I can get money to buy more. And of course, that has enormous consequences for people when they don't take their medicine, right? Which then ends up costing the system money more. If you'd just given them the high blood pressure medication, they wouldn't have had a stroke. Their kidneys would have been blown out. Now they need dialysis. We hear that all the time. 62% of bankruptcies because of medical bills. 62%. The majority started out with insurance. So even if you have insurance, don't think you're safe because of the deductibles, the ceilings, all of that. They started out with it. And of course, it's the #1 issue in every union fight. Every single union fight is about who's going to pay more for health care. And they're always trying to put it on us. So that's why the issue is so critically important. So I got an email from President Obama this week. I don't know if you did. Did anybody get this email from him? How thoughtful of him this holiday season. And this is what he said. Helen, as we head into the final stretch on health reform, big insurance company lobbyists and their partisan allies hope that their relentless attacks and millions of dollars can intimidate us into accepting the status quo. So I have a message for them, from all of us. Not this time. We have come too far. We will not turn back. We will not back down. And then he asks me for $5. Or a little bit more, if I can afford it. And, let's win this together, President Barack Obama. So, well, why don't we look at what's happening with the health care legislation? Because, these relentless attacks and millions of dollars. The America's Health Insurance Plans, AHIP, they had a checklist for this round of healthcare reform. And they had a couple things on their checklist that they wanted to get out of this insurance reform. They're not fighting insurance reform. They're shaping it. They're not fighting it. They're fighting to get more, get the legislation that's going to benefit them and their investors. But they are not trying to take the debate down as they did in the 90s. So their checklist, #1, we want to be in business still, making billions of dollars in profits. They got that, check. They got that. No question about it. No real cost controls in the regulations. That's admitted by, the 23 economists who sent a letter to Obama. It's not going to really control the costs. It's not going to change the profit margins of the shareholders. So they won that, check. They got a mandate. Probably the other most underreported story in the United States right now is the mandate. That will give them 30 million new customers punished if they don't buy the crap insurance they're going to be offered. So we're all going to be punished with some kind of fines. It could be anything from $95 a year to $1,000. We don't know yet what that penalty is going to be. They're still going to be able to deny care. That's true. they're still going to be able to raise premiums